Hi everyone, here at Paws and Claws Animal Shelter. Dr. Mike Strecker here. We got some puppies that came down from the reservation, and you can see their skin, their hair is very thin. They have little tiny dermatitis-like spots. We call that miliary dermatitis. And they just look a little rough and stuff. So a common cause for this is sometimes mites living in the skin. Sometimes people call that mange. There are different types of mites that can live in the skin, so you always want to do a diagnostic test to determine what you're dealing with. Other causes can occur that can cause this, so we try to do a skin scraping. A skin scraping is a little barbaric. We do have to scrape the skin. It's almost like getting a rug burn on your knee. We scrape till it bleeds, and we try to get some of the mites to come to the surface, and then we have to look at it underneath the microscope. Some dermatologists recommend scraping 3 to 5 locations. I usually start with 1 or 2 and see what we find. So we're going to try to do this and see how the puppy does here. It's always tough to decide where to scrape. I usually try to find an area where we have good hair loss, but unfortunately our whole body is covered like that, and so it's making a tough decision here on this one. I think I'm going to try here at the base of the ear right here, and we'll see what happens. So you do scrape with the scalpel blade sideways. Obviously you wouldn't want to do this on your own unless you're really used to it. This is what your vet would be doing. And you can see how we're scraping the surface. And then I'm going to squeeze a little bit now. Try to get some of those mites to work their way up, and you can see a little bit of the blood comes now. See, it's kind of like when you scrape your knee, like I was talking about. So this puppy's doing very good. Probably feels a little good because it itches. It's like scratching yourself to the point where it bleeds though, and then it's not going to hurt a little bit. So, oh, there's a little cry. Okay. I'm going to start with 1 scraping. We'll see if we get lucky with this. That way we don't have to do too many. So we're going to come over here then. And then what we do is we take the scraping, and we got to put it underneath the microscope on a slide, and then look at it underneath the microscope. So we're going to put that there. Sometimes try to mix it up a little bit, because if it's too thick, they won't be able to focus through it on the microscope. And then we're going to cover that. I'm going to get another cover slip. That one's kind of gotten dirty now. Okay. And we'll see what we can find here. If we see anything, we'll let you guys know. So far, hair, skin, and blood. And mites can be tough to find. That's why we sometimes have to do multiple scrapings. And these guys have been treated a little bit with a product, so their mite counts might be dropping. So if they're dropping, it's going to be tougher to find them. So we scan back and forth across the slide, checking one field after another so you don't miss anything. And so far nothing. And that's what happens sometimes with skin scrapings. It can be difficult. The most common mite for puppies to have is Demodex. Demodex is a mite that's found in all organisms, including ourselves. Believe it or not, if we were to do a biopsy of our eyebrows, we'd probably find some Demodex living in there. They're just natural residents, but usually the body keeps them in check. In puppies, we oftentimes get a condition called juvenile Demodex, which is where their immune systems are overwhelmed by the amount of Demodex that's there, and they can't keep it under control. And so then we try to get them to the point where we can keep it down, knock it down, and get it to a normal number of Demodex. Yeah, so far striking out. So this is where we got to decide, do we keep doing more skin scrapings and see if we can find a better location that might give us an answer. Is it Demodex, or is there another mite called Sarcoptes that they can have? So that's where it gets a little tricky. But so far, nothing to show you guys. Yeah. When did you first do the treatment here? Has it been a little while now?
About a week ago.
Yeah, so it might be doing some good. So it might be knocking the numbers down a little bit. When you treat them for Demodex, obviously the hair regrowth and stuff takes a long time to come back. So you're not going to see the response as quick as you would expect when you're treating like a wound or something like that. So, and then the goal is to treat until you get 2 negative scrapings 2 weeks apart. So this would be considered a negative scraping now because I'm not seeing anything. But I could have just missed, and that's why dermatologists say check multiple locations. So we got to decide if we go back and do another location or not. So we do that.
Sure.
See if we get any luck. All right, we'll try another one. Sometimes between the toes, but I don't see a lot going on there.
A lot of bumps in here.
Yeah, we do have a lot on the shoulder, and the armpit here.
Up in here.
The ear margins sometimes are good too, but there's not a lot of hair loss there, so I'm not going to do that. We'll have to get some ointment out for these guys too. Maybe we could try the elbow. Let's see what happens here. So we're going to try right here on the lateral elbow a little bit. See if we can get any luck there. Squeeze a little bit. So with the squeezing it does, the mites live in the pores. And when you squeeze it, it hopefully pushes them up to the surface a little bit, so hopefully we're more likely to get them when we scrape, if they're there. I know, kind of rub the ears, give a little love, so we're not thinking about this. The other option is a biopsy, and that actually is much more accurate, but then you got to punch a hole about the size of a pencil eraser into the skin, and that we send off to a pathologist to look at, and that can actually be a little more accurate than a scraping sometimes. So that would be an option too, but it's a little more invasive. Okay, let's see if we got lucky at all. All right. Oil. Let's see what we get there. Whoops. Okay. So we put the drop of mineral oil, just mineral oil, and then we're gonna mix in the scraping material we got off, which is mostly hair. Obviously, you're scraping on the surface of the skin, so you're gonna pick up a lot of hair on a dog. And then there's some skin, and we're hoping some mites. Then hopefully we'll see what we find.
Any more oil, or is that enough?
Yeah, get a little bit more oil. I'll do it. Let's see. Oh, we gotta get a new syringe. Our syringe is getting sticky. Hold on. Okay, we're gonna get another syringe. The syringes with the oil get all stuck up the plungers. There we go. There's a drop of oil, and again, you do your cover slit. And then we'll swap out the slides and see what we got. So there is a chance it may not be Demodex. It could have just been an environmental, nutrition thing. Things can play a role on the hair, on skin. If in doubt, if we don't find anything here, we'll still treat. Nowadays we have newer treatments that are a little safer to use. Some of the newer generation oral type products like NexGard and Brovecto can be used. So we're probably going to continue with the treatment and just see how they keep responding. If it is a mite problem and they're not finding anything, you still want to, and you assume it's a mite problem, you're still going to want to treat for probably over a month. Sometimes we treat for several months, so depending on how their skin does. So, not picking up anything. So there you go. Well, yeah, it's good, but it doesn't give us an answer. And that's what happens with medicine when you do diagnostic testing. Sometimes the only answer you get is that at least you're not seeing a lot of them. So, okay. All right, yep, none in this scraping either. So then we have to decide if we do more scrapings or go to biopsy. We could even try another one of the puppies because there's several puppies in this group. So one of them might have more in the skin than the other one. So that would be an option. And see where things go. But yeah, I am not picking up any mites right now. So it might even have been an environmental type thing where they were housed, if it was had chemicals or dirtiness and stuff like that. And we don't always know the answers to that on these rescue dogs. So, okay.